This morning in Living Healthy, we are chatting about integrative medicine. Back in studio this morning is Dr. Sztykowski from the Centers for Integrative Medicine and Healing. You know all there is to know about integrative medicine. We've been telling people where you're from for so long now, but let's break it down a little bit more. There's alternative, functional, and complementary medicine. How is integrative medicine different?
Integrative medicine actually includes all of the above. We came up with the name COM, which stands for complementary and alternative. There's also a functional medicine, which used to be kind of separated from Western medicine, and they were on their own, if you will. Integrative medicine integrates all the best medical systems in the world, being a Western medical system with more natural systems together, and therefore I believe it's the best medicine available at this point.
But they're different then from conventional medicine,
They are
right?
different from conventional in the sense that conventional is simply what we know as a Western medicine, which will be, you know, medications, surgeries, and typical stuff that most people are exposed to. Integrative medicine, we still utilize the Western medical testing, lab test, and diagnosis, but we prefer to choose more natural medical treatments rather than medications and surgeries.
Which brings up a good point. Do you feel then that a new healthcare system, or there should be a change in a
Well,
new
you know,
healthcare
interestingly, Obamacare has included a little bit more of integrative/functional medicine into the coverage. How that's going to play out over the next 5 to 10 years, we don't know yet, because states have a choice of whether covering or not covering this. But there is definitely talk about it. There's a National Institute of Health committee that relates to the integrative medicine and functional medicine. So there's some movement towards this direction, but we're yet to see, you know, what's going to happen over the next 10 years or so.
We'll have to wait on that. You integrate a lot of integrative medicine at your practice. How?
That's what I do 100% of the time. You know, the way I do this is, again, utilizing my Western medical training in assessing the patients, diagnosing, going through their records and so on and so forth. But at the end of the day, I'm looking also for what Western medicine generally doesn't do. I'm looking for the root problem of every patient. That's more the nature of integrative medicine. And once I find the root problem, I apply more natural treatments. In my case, I use mostly Chinese medicine to treat my patients.
Yeah, and why do you think that should be used a bit more?
Because it's very effective. Chinese medicine has been around for 8,000 years and has proven that it helped billions of people with, you know, myriads of problems. You know, most people think of acupuncturist medicine being good for pain or maybe quitting smoking.
Right.
Truth of the matter is it treats pretty much everything out there,
really?
Health-wise. Not only that, it can prevent. As we talk on the other show, you know, it's a great medicine to relieve the stress and prevent things from happening.
Now, quickly before I let you go, are there any limitations then when it comes to the treatment?
You know, limitations are, I always say the disease is not a limitation. We can technically treat any disease. Some patients simply do not respond to our treatments. And we know this usually within a few visits. In my office, that's about 3% of patients. So,
wow, numbers are pretty good then.
It's a pretty good statistics, yes.
Excellent. If you'd like to learn more about the Centers for Integrative Medicine and Healing, just head on over to WPRI.com.